Now here's where we get decontaminated, right here.
Looking over pictures, Dr. David Poremka's words are soft-spoken, but they carry tremendous weight. This physician has more than 30 years of medical experience, but 1 month in Africa treating Ebola has changed him forever.
Families were decimated, village was decimated, and so forth, and they need help.
The West Africa Ebola outbreak began in February, and cases continued to climb well into the summer. That's when Dr. Poremka knew he had to do his part and volunteered to go to Sierra Leone.
I wanted to help. I told my kids there's a good chance that I might not come back, and just to be aware of that.
Dr. Poremka was sent to a hospital in Kenema, the nation's third largest city. The hospital, it's nothing more than a collection of small buildings and tents, but Dr. Poremka's team treated nearly 100 patients each day, all without any semblance of modern medicine.
We're at a point that we almost ran out of the white protective suits. Luckily we had gloves, but I don't know if they were the best gloves.
Protection was paramount. However, even with safety measures in place, Dr. Poremka's clinic lost 38 nurses to the virus. Despite the danger, Dr. Poremka and countless volunteers risked everything to give strangers a chance to survive.
It's taking care of the patients. The patients over there should be no different than patients here to be able to treat it.
Picture after picture, this doctor is moved by the faces. Men, women, and children who are on death's door but somehow are alive today.
He was positive. We took a blood sample and we told him he's negative and he's calling his family.
Ebola is a formidable opponent to both the patient and care provider. The outbreak may not be fully contained, but the work of volunteers has definitely left an impact. But if you ask Dr. Poremka, that work is far from finished.
Will you go back?
Absolutely.
In Sioux Falls, Jake Iverson, KSFY News.